H.R. 676.
What's that number again? H.R. 676.
That's it.
All right, we got one. We're going to have Edith back up for a moment, and we're going to finish up for the day. I want to thank everybody who came out here. This is really the key. You need to be visible. You have to make sure that our elected officials are aware of your desire and need for health care change. And I applaud in each and every person that came out here. I want to thank you very much. Edith?
Okay, Chick, I lost it. Joan Uebelhoer is going to speak before our program is ended. Do you know how to do microphone?
I volunteer. You've never been in this situation before, you know.
So how's that? I'll just keep following it around. Right. I brought notes with me because I've heard people say that the older you get, the more memory you lose, and that's not true at all. It's the older you get, the more you have to remember, and so you have to write some of it down.
Amen. Yeah.
I spent a good deal of my adult life trying to make the world better, equal, safer for women, and now we're talking today about health care. And am I going to tell you this is a woman's issue? Wouldn't that separate us? Of course, the health care is a disgrace in this country, but it's not exclusively a woman's issue. This country is very far behind the industrial countries in the world in supplying health care, and that is certainly a huge concern in the lives of all of us. But women are 75% of the poor. We're in the majority of the people who don't have health care, and we're especially vulnerable because we're the majority of the folks who work at places that don't include health care with their workers. The wind is not supposed to be blowing when you bring your notes with you. I was at a meeting earlier in this campaign, and there was a person there who said, "I do not want government health care," and I quote, she said, "If a person does not follow health rules, why should I be obliged to supply them health care with my tax money?" Well, the answer to that was certainly we're in this society together. If the person next door to me doesn't put out a cigarette and sets his house on fire, I certainly want the fire department to put out their fire, and I want my health care, my taxes. Oh. It said return to Democrat headquarters under here, and I thought, I'm supposed to leave now and go back to Democrat headquarters. So health care is a right. Health care is a right for everybody.
Yeah.
Today is Medicare's 44th birthday. It's been my health care for 15 years, and it works very well. Today is sponsored by Hoosiers for Common Sense Health Plan, and I'm certainly one of those Hoosiers. I want that Common Sense Health Plan adopted for all us men, women, and children. Whenever there's a drastic need for change, like the one we're facing today, you see and hear, and I heard it on television last night, people say, we mustn't hurry. We mustn't hurry. Well, I'll tell you about mustn't hurry. The founding fathers said all men are created equal, but they waited 42 years before they let me vote. And there were probably people standing at that thing saying, don't hurry, don't let them vote. I turned 80 last December, and getting health care for me and other citizens of this country does not seem like speeding recklessly toward change. Other nations have done it. Isn't the United States of America supposed to be the greatest nation of all? The people who are opposing us today are not teabaggers, they're foot draggers.
Yeah.
And I hear you all say we must talk to them calmly, we mustn't be rude. I turned 80 in December. I don't have time for not being rude, so you better keep an eye on me.